Hi and welcome. I'm Tara Akuna and welcome to Acu Show and Tell. Today I have Dr. Deanna Weiss, naturopathic doctor, joining me today. Thank you so much, Deanna, for coming on.
Thanks so much for having me, Tara. I'm so happy to see your face.
Yeah, I'm happy to see you too. Dr. Deanna and I had worked together many years ago, and she's a fabulous acupuncturist, very highly skilled. And she also practices the balance method, which we do. And today we are going to discuss a case regarding fertility and more specifically achieving pregnancy.
This case, I do feel like is a really important one because I've seen it many times, like I'm sure you have too, especially when we worked together at the village and we were near the midwifery
Oh,
clinic, right? And then we were near some of the fertility clinics and had people coming in.
yeah.
And this was just such a common case for fertility and easy to treat. So I do think it's really important.
Hmm.
So for this patient, she's a 36-year-old female who came in to see me with fertility concerns. She had been trying to get pregnant with her partner for 8 months. She does have a 4-year-old at home, and she did describe to me that getting pregnant that time was really fast within 3 months of trying. And so this felt like, okay, this is a really long time for her. She um, was also describing doing all of the hormone balancing kind of tricks and things you kind of find online, sort of like what's in her control, looking at basal body temperature tracking. She was doing the ovulation strips and to find out if there's an LH surge. And so, from sort of the physiological or the body perspective, I started to look at what's going on with her hormones. With the ovulation testing, that was great. So I already could ask her and find out that her ovulation was at days 12 to 15. Checking in more with her period tracker, she was having a monthly period about 28 to 31 days. She also wasn't having like a heavy cycle at all, no clots, kind of regular flow, 4 to 5 days in length. But she was having PMS symptoms. Her PMS symptoms were mood changes, specifically irritability. She was having breast tenderness, acne along the jawline.
Mm.
So that was really the only thing from a hormone perspective that was standing out. Now, as a holistic practitioner, like all of you, I'm looking at, okay, we've got the body, the physiological, and investigating that. Things are seeming pretty good. So then I want to look at what's going on with the mind, what's going on more holistically, stress, sleep, energy, digestion, mood, all those kind of questions.
Mhm.
After investigating that, really there was nothing significant in terms of any current chronic health issues, past medical history, nothing significant. The thing that did stand out was stress.
Right.
So, looking at her life, she's working full time. She's got the 4-year-old that she takes care of, outside of the daycare and school. She's in charge of her home life. Her partner runs his own business. So he's working like crazy hours. So there's a lot on her plate.
Yeah.
Also, just looking at this patient coming in and how she is kind of following all the steps, maybe a little more type A personality.
Mhm.
Um, very concerned about the 8 month of trying
Yeah.
when in practice, we don't consider infertility until after a year. So she's in this spot where she comes to see me because it's like, does she go to a fertility clinic, look at those options, or is there anything that we can do just more naturally and not so invasive?
It's nice that you have that additional tools and background that you can really kind of dig into her hormones, and you can
Mm-hmm.
see that hormones were looking pretty good, but you really noticed that stress was maybe the thing that was standing out for you the most. You said something interesting, like how she was very like rule following, like wanting to follow all the steps, that kind of rigidness, and like tell me what to do next, like that type of thing
Mm-hmm.
showed me to me that that would be more of like a liver cheesesteak nation area.
Totally.
So that's one way that you could go, and we're going to share your points in a minute. But typically, what I do is when somebody just comes in and I'm just starting, I'll just go to like a basic hormonal because it also like addresses stress and digestion as well. So it's a really kind of complete treatment plan. And then I feel like if something's not happening, then I might dial in more, or depending what they come back to me with after. So for my treatment plan as a balanced method practitioner, I did the Dr. Tan's OBGYN 8. And the points for that are it's going to start with Yin Tong, Ear, Shen Min, and En. And then for the body, on one side, I'm going to do large intestine 4.5, Sanjiao 5. And on the same side, I'm going to do kidney 7, spleen 4, 6, and 9. And on the opposite side, I'm going to do pericardium 6 and then 7.2. And that's a point that's just a little bit more on the palm of the hand, more like the heel of the hand in the middle. And then heart 5. And then for that leg, I'm going to do stomach 36, gallbladder 34, and 41. So those would be the points that I would do. And what did you do with her treatment? How did you go about it?
I, from a naturopathic perspective, I did talk to her about nourishing her body because, as you said, more being a little more rigid, then she's going to have a tougher time relaxing. She's
Mm,
like the great patient that'll do all the steps, do everything, but her body actually needs more kind of relaxing, going inwards, listening to her body. So we
mm,
talked a lot about the word nourish and how to nourish through lots of good, healthy foods, lots of protein, cooked foods, and which TCM, there's a lot that you guys can do with that. I mean, you have a book on
mm. Yeah.
it. And so rest for sure, part of that conversation. And I did give her Vitex, which is also known as chase tree, which is a herb that's a Western perspective. So kind of helping take cortisol, convert it into progesterone. And the common signs that when people need this are like the PMS,
Mm,
or they just have lots of stress. So I did a drop dosing, 20 drops of that in tincture form every morning.
nice.
But then the big part of the treatment plan was doing acupuncture. So the
Mhm.
points that I did on her were yin tong, do 20, in the ear, shen men, and sympathetic, bilateral. And then I started with the left side and did Sanjiao 10, Sanjiao 3, then liver 8, liver 3, and then right side, gallbladder 34, gallbladder 41, and then PC3 and PC6. And so if you practice the balance method, you know that that's Jue Yin Xiaoyang,
Mhm.
number one for stress. Yeah.
Yeah, I use it all the time.
Yeah. I mean, I need it sometimes
Oh, me
too.
too.
Yeah.
Yeah, and how did things go with her?
So when I saw her, it was around between ovulation and it was pretty much PMS time. And so we did treatment then, and then 2 weeks, and the second treatment, and then 2 weeks again, a third treatment. And by the time I saw her at the 2 month mark, she was pregnant.
Wow, amazing.
Yeah,
That's so great.
yeah.
I love this treatment because it's not just addressing hormones, and it's not just like a treatment to achieve pregnancy, like from like, okay, what are the points that are going to like warm the uterus or get the blood flow in like the pelvic region? Like you really went with what was presented. And,
Mm-hmm.
really what was presenting, even though there was an issue of wanting to get pregnant, what was presenting was there was more stress. And
Yeah.
because you worked with that, that allowed everything else to happen and for a successful pregnancy to be achieved. So, Deanna, it was really nice to see you today. And
Yeah. Thank
if
you so much.
and if anybody wants to get in contact with you, I will put your information down below. Um,
Sounds good. Yeah. I'm always happy to chat acupuncture stuff, anything to do with like hormones, diet, um, autoimmune, I mean, mental health.
yeah, for
Those are
sure.
kind of the big areas. Yeah.
Dr. Deanna is in the Greater Vancouver area in British Columbia. So you can get in touch with her if you are close by.